Hey, Cam followers, we are back. I am very, very happy to introduce to you the lovely Dr. Laurie McCauley.
Hey, everyone.
Yeah, she's all the way from the US. We've got another massive influencer from the US coming over to the UK. So I'm really, really happy. I'm afraid I'm in my camper van still. This is why the decor is a bit weird. I hope the signal's going to be fine. It seems to be okay at the moment. What I'd like to do is get Laurie to just introduce herself, tell all of us how wonderful she is, what she's been up to, tell us about the course that she has there on display, and then we're going to crack on and start talking about laser and osteoarthritis because it's very, very prevalent over here and we just want to get some more detail about it. So tell us about you first.
Okay. I graduated vet school in 1992. I did 6 years of general medicine, and then I fell down the stairs at 3 a.m. putting my dogs out, and I went to a surgeon because my chiropractor couldn't fix me, who sent me to a physical therapist, and I went, oh my God, this is so cool. Yeah. And I decided I was going to do physical therapy for dogs, and we turned it into rehabilitation. I designed the first underwater treadmill. I got to play with a whole bunch of equipment that I helped design.
Wow.
Oh, you didn't know that?
No.
Yeah. I had cameras and monitors, and it was awesome. I had the first one in 1998.
Where were you working?
Chicago?
Wow.
Yep. In fact, there was no box underwater treadmills. So It was a human one on a jet ski lift in the first pool. And we would lower it down. And then I learned that if you keep doing this, you get elbow tendonitis. So when we built our new building, we put a hydraulic lift in, and you go, and the pool would go down. And I had aquarium glass from like the zoos in there so that we could have a camera and we could video it. So you could be watching up on the camera and see what the dogs were doing.
Wow. That's amazing. That's like, yeah. That's with you.
Woohoo! Actually, I have to do with this hand so you can see.
Cool. Okay.
And then I started teaching.
Yeah.
I taught the certification course for 14 years for Canine Rehab Institute.
Yeah.
Stopped doing that in 2017. I've lectured England and Germany and Australia and Mexico, all kinds of awesome places besides all over the US. I got to write chapters in textbooks and magazine articles and just all kinds of fun stuff. I love teaching.
So easy, doesn't she? So we're going to be blown away with this. We're going to be so blown away. And hopefully you're going to be able to, in a very independent, unbiased manner, start delving down into where does this modality fit in. And that's what we really, really want. Okay, so Cam is independent. It's very owner-centric. It's for the people. And what we want to do is get rid of the marketing, and we want to kind of go, right, this owner has this dog with this budget, with this time scale. What's going to really make a difference? And before we went live, I said about me being owner-centric and rugs and weight and everything and how it's actually foundational. Laurie's 100% there. So, we'll come back to that later. But let's dig into laser. What is laser to start off with?
Okay, I know you said no marketing, but I do just want to say that I have the course. The laser course is 19 hours. So all the information you need as a vet professional to know whether it be a class 1, class 3, class 4 laser, everything you need. It's got how-tos, when, why, where, understand the variables so you can use whatever machine you have, again, unbiased to the best of your ability. And coming up will be a pet parent laser course. So for your pet clients, that is already in the works. It's already in the process of being written. So it'll be
so important because we were talking about how many products there are out there and people just don't even know what's truth, what's fictitious, and if there is truth, then how do you use it wisely? So that's going to be awesome. You have to let us know. And I will have a confession. I think I'm halfway through your course. And I keep going back. Yeah, I'm halfway through, but I keep going back and starting again because I'm like, right, okay, I got to get this in my head. It's very, very good. It is very good, guys.
Thank you.
If you are introducing laser into your first opinion practice or your rehab center, and you want to have a greater understanding, then it is very, very worth doing. Cool. So what is laser?
So laser is light amplification magnetic radiance. You don't have to worry about all that. It's basically light that is monochromic, so one color. It is collimated, so all of the little wavelengths, right, because light is a wavelength, are going in the same direction, and it's coherent. So it's not even just like they're all going literally together. And that's what allows penetration, which is the big difference between laser and LED. Right. And LED is monochromic, but it's not collimated. So it's just splattering at the tissue.
Yeah, that's a really good explanation, actually, because a lot of people are unable to distinguish the difference because marketing gets in the way of really saying LED in these handheld home management devices, aren't they? So, guys,
I mean, everything, all light therapy has benefit, but it's what is it for? Yeah. So your LED is great for skin issues like wounds. You wouldn't want to be lasering into your eye, but you can use an LED for a corneal ulcer or a stye or an infection around the eye. But it has no penetration.
No, and I don't know if are there any legal requirements to be clear about what that device is? Because I know when you look in the back of the newspaper or in magazines or online, quite often they might slip in handheld laser and you're sitting there going, wait a minute. Not for that price, I don't think so. Is there any legalities that to stop them using the word laser in their marketing for LEDs?
Every country's different.
Right.
So you really have to pay attention to what you're buying. You can look at what their FDA clearance is, but even with the lasers, only a few companies have FDA clearance. So drugs have FDA approval, devices have FDA clearance.
Right.
But if you have a device with FDA clearance, especially if they have a line that they're using by medical professionals for patients, that's usually a better machine than a company. Let me say that differently. That means they've put research into their equipment, because there's good machines out there who may not have FDA clearance for humans and they're staying on the animal line.
Yeah.
But it's one way to look at it.
Okay. And is it fair to say that you're not going to be picking up a laser for like under $200?
I don't know that you could pick up a laser for under 2,000. And honestly, your decent ones are going to be more like minimum of 5,000 or 6,000 and upwards, 12, 18, 25, 30,000.
Yeah, exactly. So take it on a really simple stance, which is Hannah's brain, is if it's pretty handy and cheap, it's not going to be a laser, guys. So it'll be
it's LED. Not a laser.
And the simple difference between LED and laser is penetration, and our joints are deep. So these handheld lasers are not going to be impacting the joint. They're going to be working on the surface. So let's go back to laser. If people want to ask us about LED later, go for it, guys, because this is an opportunity to get it clear in your head. Laser. So we know that it's monochromatic. We know that it's coherent. What else do we need to know about it?
Different wavelengths have totally different effects in the body or to the tissue. So even if you have a laser, if you, like, I go to the dentist and he gets done cleaning my teeth, he uses a laser in the blue spectrum because that kills the most bacteria on my gums before I leave. Right. So that's blue, and that's really good. They have studies looking at kids with like bronchial asthma, where they laser blood vessels like twice a week for 3 weeks, and then they follow them out for a year, and the heme, right, from in the blood absorbs that energy, and they had more than a third less hospital visits over the next 3 years.
Wow.
So it can affect the lungs even just by hitting the arteries. As well as dogs like with fibrosis and other things, we can treat the lungs, the heart, the kidneys, the liver, all kinds of stuff.
All kinds of stuff. So the wavelength is really important, and you will generally find that written on the machine.
You will, on the probe, usually you will find what wavelength, but certainly when you buy a laser, it should have in their specs, legally it should have in their specs, what the wavelength or wavelengths are.
explain that, because a lot of people are going, oh, but she said it was monochromatic. Now she's suddenly saying that it's got different wavelengths. What's this about?
So some of the lasers have a probe, and for each wavelength, you have to have a different substrate. So like gallium, aluminum arsenide is one, helium neon is another. And that substance, when energy is put into it, will create the photons that dance around. And then there's, in the laser itself, all the photons have to go through this tiny little hole, and that's what makes them coherent and collimated to get into the tissue. Once it gets into the tissue, it can have different effects, and you can have different effects like your 970 and 980 nanometers. That's absorbed a lot by water. So those are your lasers that are going to produce more heat, and you're going to have to saturate the tissue in order to get your depth of penetration. And by doing that, you're going to be, when you look at how much energy you have to put in, it's a lot more. So that's like there's an elbow study on dogs that using the companion laser at 4 and 8 joules per centimeter squared for a big dog, they had no effect. But at 20 joules per centimeter squared, they had great effect for that laser. If you took a Respond or a Cutting Edge or another 3B that doesn't have that 970 or 980 wavelength, you would like burn the tissue, right? It would just be a bad thing. But for that laser, that's a good idea. When you look at laser, so laser started, Einstein talked about it in 1917. First patent was in 1950. First research was in the 1960s. At that point, they were talking about ideal was 1 joule per centimeter squared. Now we're talking about.
Sorry about this.
I was going to say, is that a motorcycle?
You know when you park up and you think, no way, there's a kid on a motorbike doing laps around my van. He's going. Yes, now carry back to the history of the laser.
All right. So at that point, they were looking at 1 joule per centimeter squared. And if you went above that, you can actually have negative effects. But that's because it was in the 600 range. Right. So that wavelength, 600 range is your red, right? So you don't want a lot of power when you're using that. You're going to use more when you go, your next one up would be your 904, 905. That's going to have your most penetration. So it's going to go right through the tissue, and that's the best one to get into your joints, get into your like cat kidneys. If you're going up into the liver, that's going to get your best penetration. That's really, really good for chronic pain. Something in your 800 range is going to have a little bit less penetration, so you're going to need about 50% more energy. That's your best for inflammation and pain related to inflammation. All of those are so far good for healing. And then your 970, 980, you're going to need like 3 or 4 times more energy than something in the 800 range, because you need to get through that water to get your penetration, but will also have really good effects in healing and good, bad, or indifferent. With the heat is going to have increased blood flow, right? So there's times that it's good when you have scar tissue and decreased perfusion. There's times that you need to turn it down when you're dealing with acute inflammation, because you don't want to add heat to heat, right? Because then you have your cells that make your inflammatory cells that make your degradative enzymes, and you don't want to increase the effect of the enzymes.
Right. Okay. So,
sorry, I'm spewing.
No. The thing is, though, and this is what it's like in your course. There is so much there, and you have to. That's why I said I've listened to, I think, the first 6 modules about 3 times now, because I'm like, I've just got to listen to that again.
So what you need to do is skip to part 2 and get to the fun stuff, because that's how to treat and understanding where the joint capsule is. And that's the fun. And then just go back and forth.
Keep coming back and forth. But just to recap what you're saying. So basically, guys, laser isn't just one thing. It's unbelievable tool with so many variables is what we call it. So we've got our wavelength, we've got our power, and they do
total dose
and total dose. So when somebody buys a laser machine, it's not going to just have one wavelength. Many of them will have 2, possibly 4 different wavelengths in them with different intention. Is that fair to say?
Yeah.
So this is why when you see a practice that is charging out for laser because it costs them £15,000 to £20,000, they're quite complex machines. Because I know over here in the UK, for someone to have a laser session, it could be anywhere between £30 and £55 per session. And when you're looking at doing it twice a week for 3 weeks, you know, 6 can take, it adds up. It's a big decision to make. So this is why this is a really important live, because a lot of people that listen are going, I don't know whether to invest. And I just want them to understand that the equipment is extremely clever.
Can I add some to that?
Yeah.
So just looking at a research study, post-TPLO, so post-cruciate surgery, there was a study that did one laser treatment before surgery. And what they found was, not immediately, not 2 weeks later, but at 8 weeks later, the dogs were using those legs much better than the dogs that did not have the laser.
Wow.
Right? Another really important thing, I mean, because I don't know about in the UK, but here cruciate injuries are crazy.
Crazy.
Okay. Now let's think about this. When I got out of school, which was a long time ago, right, in 92, a dog would tear a cruciate because they jumped up to catch a frisbee, they landed wrong, and boom, it's a trauma. Nowadays, it's not. It's chronic inflammation that is slowly tearing away at the ligament until it snaps. So we know from the research that if you're lasering, if you have inflammatory mediators in the cell, let me back up. The cells that make the inflammatory mediators live on the inside of the joint capsule. Those cells create the mediators that create the inflammation that tear apart the ligament. So we can preemptively, if we have a dog that we know there's any scar tissue around the knee at all, laser them even once a month or every 2 weeks or however often you go to the vet, with the idea that you're decreasing inflammation and hopefully preventing that cruciate from tearing. The other thing we know is...
That's a bold statement, though. That's a bold statement because, you know, that would be a big investment for somebody. Over here in the UK, if somebody was going to say, I'm a bit concerned that I've got a breed that's predisposed, so let's take a golden retriever, female, neutered, carrying a bit of weight, and they say, actually, I'm a bit concerned, I want to go preventative. That's a big investment on a...
Let's go the other way.
Okay.
They've already had one cruciate tear.
Oh, now you're talking a different story.
Right? Now we want to prevent, we want to slow down the arthritis because we know we're going to get arthritis in that knee. And as long as we're lasering that knee, prevent it from happening on the other side.
That's a very good point because people need to realize, and this is commonly mentioned in Holly's Army, one knee's gone, oh my God, I can't believe he's limping, and the other, what is it? And you're like,
right, 50 to 60% within the next year and a half are going to have it. Okay. And you talk about expenses. If it's $5,000 to $6,000 just for the surgery.
The only thing I would say is, have we got any studies to really prove that it has that preventative effect? That's the only thing.
Have not seen it. I do have a surgeon who talked about a study he did. Now, I don't know that he was using just laser. I know range of motion is huge too. But he went from 50% down to 17%, tearing the other side. So his idea was rehab. Right. So the exercises, the passive range of motion, the laser, the whatever else he was doing.
And that's the same with Carrie Smith, guys. If you want to go and listen to Carrie Smith doing some of these lives for Cam on our YouTube, she has found that she's brought the second limb rupturing from 60 down to 18% by making sure that they do really good post-operative rehab and continue it. So one of the really, really important things is if one knee goes, do something to try and prevent the other one going, because the likelihood is it will do. There are questions coming in thick and fast. I'm not ignoring anybody, but we're going to try and cover some ground and then we'll go to the questions because they're quite specific. So we've talked about the variables. So we've got wavelengths, we've got frequency, we've got power, we've got time.
Yep, we have total dose.
We've got the handheld or the compression. We've got so many different things. For somebody like me that hasn't got your brain, how do we navigate all of this stuff to make sure that we're treating the area of interest to the best of our ability?
The course.
Yes, but I know in your course you also say that every laser company have protocols.
Yes.
And you can't take a protocol from one and
use it with
transfer it to
another.
another. And I found that amazing. When you said that, I was like, whoa. I couldn't get my head around it, because they say that they've got the same wavelengths and stuff. You think, well, it should just be transferable.
Okay, so understand, each company has patented their approach. So where one may have this wavelength and this wavelength, they may be going, I'm going to treat this wavelength first and then this one. And another one may be having this wavelength and this wavelength and treating this one first. Or this company may have both of them going at the same time, but they're all different. So, and understand that they have their hand on the pulse of the people that are using their machines.
Yeah.
So they're the ones that are going to be able to say, you know what, we've heard from our 1,000 people that have this machine that if we do it this way, we're going to have better results than if we do it this way.
Yeah.
So working with the company can be really helpful too.
And so put it into really simplistic terms, nurses, vet techs, therapists, whoever are handling these machines, breathe, look at your screen, follow the directions, be as accurate as you can regarding the animal that's in front of you. And for example, I've used Companion quite extensively. It'll ask you the weight, it'll ask the color or the length of the coat, the region that you're doing, what kind of inflammation, is it acute, is it chronic, what's going on. And you have to go through these series of questions to get the most appropriate setting to treat that area. And then you're given an exact time scale of how long to treat that area and in what fashion to treat it. So with K laser, for example, you're moving the probe a lot. Companion, you're moving I like the massage ball. I quite liked that. Whereas you've got another class, the 3B, which quite often you can hold them in place, can't you? You don't have to move them so much. Can we just let people know the difference between, we've done LED and laser, now let's do 3B and 4, because there's always a bit of contention there. And it was lovely talking to you, because you just haven't got a favorite. You see benefit in both. So tell people the difference between the two.
Your class 4 lasers were created because of the wavelength 970 and 980, because you needed more power. Understanding doubling your power increases your penetration by 5 to 10%. So you have to have a lot more power to saturate the tissue to allow you to get deeper. So that's where the class 4s were born. When you look at the original research, and actually 90% of the research that's out there right now is with 3Bs. Right. So there's a lot of, and don't get me wrong, the class 4 lasers, Companion, Sumis, K laser, Respond now has a class 4, Cutting Edge has class 4, and they're actually coming out with a bigger class 4. Those guys are putting money into research so that we can figure out how to use their machines correctly in an unbiased fashion. But you can do really good things with 3B as well. Right.
Cool.
When we look at humans, I mean, there's research using F3 and F4, which are the points that are right here, for anxiety and depression. I know someone who's done research using a 3B at the foramen magnum, the back of the head, for aggression in dogs with really good results. Right. So you can use both lasers with really good results. You just need to know your other variables.
And I think what I've found is, and this is a really simplistic look at looking how people handle the different machines. When I've seen therapists who tend to have 3Bs, they use them in a very focal way. So they're looking for trigger points, they're looking for tension, they're actually choosing key points around that joint to get into the joint capsule, get into the joint space. So they're very precise. And you'll see them holding the probe in place, and it might be for 10, 15 seconds, then it'll beep, and then they'll move to another place. And it seems to just be very methodical and very thought out. Please don't shoot me, but with the class 4s, because you're having to keep the probe moving, it feels very generalist. Because it's so much more powerful. You might be treating the stifle and you're not looking at points on the stifle, and you're going all the way around it in a much more kind of generalist way. Is that terribly naive for me to say it like that?
No, it's actually a really good point. I mean, you still, even if you have a class 4 laser, even if you have the Companion, the Sumis, the K, all of those guys where you have to keep moving, you can still focus once you know the anatomy. So can I diverge for 1 second?
Yeah, go for it.
Because this is really important. With osteoarthritis, like I said before, the inflammatory mediator cells are inside of the joint capsule. So there's research, meta-analysis that looked at over 200 studies, 88 fit into their group of having the right dose. When you have the right dose, so not way too little that you don't get anything or too high that you have a bad effect. The studies that treated the joint capsule had a positive effect. The studies that did not treat the joint capsule had no effect.
Right.
So you can, even if you have to keep moving, if you know your anatomy, know where your joint capsule are, where your tendons and ligaments, and which muscles support the joint, you can get much more efficacious effect and be more efficient, so less time consuming, if you're treating those specifically, even though you're moving.
Right. Okay. No, that's good to know. That is good to know. Okay. So we've talked about the variables, and our followers that are watching are mostly owners, but there are some therapists popping up. So there's going to be some interesting questions. So we've talked about the variables: the wavelength, the frequency, the power, the time, the probe head, the right choice of anatomy, knowing what tissue you're treating and what is wrong with said tissue. So now let's talk about specifically about osteoarthritis and what kind of laser. So I'm just gonna put you on the spot, and we're gonna just go through different joints, because somebody's made a very clear, a really good question saying, do different joints respond differently? Where was it? Oh no, where is it? Yeah, this one. So I think that's quite a good question, because we've got joints at different depths. So this is so if you had a dog that had really significant, like let's say grade 4 out of 5 hip osteoarthritis, let's start at the back, bilateral, significant pain, already on a NSAID, intermittent paracetamol for acute flares and background gabapentin, they were carrying a bit of weight because they're Labrador. What kind of, and you had your selection of modalities, so we're going to do all modalities and then your laser shelf. So what would you do?
So first of all, you're using meds, right? Better living through chemistry, right? There's no reason not to help them get out of pain. And CBD is something that I don't know if you guys can recommend.
We're not allowed to over here.
Okay.
It's at the end of the prescribing cascade. So over here in the UK, we have to perform recognised veterinary practice first. And because there is still a deficit in the knowledge with CBD, the other medicines just have way more safety and efficacy data. So we have to go down that route. And if we get to the end of that path and go, what else can we try? Then we can use CBD.
Okay. Yeah. Or hemp, the whole hemp product, right?
Yeah.
Yep. So then other things like, do you guys have a CC loops or any kind of PEMF device? I know Respond has a bed. There's Beamer beds.
So we can get hold of a CC over here. It's not routinely available. We've got Westville, which is a company that does a PMF pad, so the dogs can just lay on it, dogs or cats. So no, it's not readily available. What's your thoughts on that?
Love it. I have a pad that you're going to laugh. I used it for my dachshund. He lived to be 18 and a half. Wow. And now he's gone. So the pad has Velcro because it was in a carrier and it is stuck to my office chair. So every time I sit down, I push the button and it treats my back.
I think I was thinking of doing that because the studies that I read about PMF for chronic pain, they did suggest quite a long duration. And that's something that I've always struggled to get my head around, is that going in for a treatment for 10 minutes every other week, is that really going to cut it compared to the studies out there that some people are having PMF 10 hours a day?
Right. So that's the difference between targeted PEMF and non-targeted PEMF.
Right.
Targeted PEMF is going to, there's a great study in humans with knee arthritis where they treated with non-targeted PEMF, which is pulse electromagnetic field therapy, for 12 hours a day, and their VAS, visual analog scale, so how much pain they're in, 1 to 10, dropped 25%, which is great, right? Because if you're in a lot of pain, that's good.
Yeah.
Targeted PEMF, treating 30 minutes a day, so 15 minutes twice a day, dropped the VAS, same other protocol, by 50%.
Whoa.
Big difference.
We're going to get you back to talk about the difference between those two.
And then another study with dogs. Dogs with knee arthritis.
Yeah.
Half of them had PEMF for 21 days. Half of them had Previcox, so an NSAID for 21 days. Both did really well. Then they stopped both. And within like 2 weeks, the dogs that had been on the meds started having problems again.
Yeah.
Most of the dogs that had been on the PEMF bed, PEMF loop, I wasn't a bed at that point, 4 months and 12 months later were still significantly better.
That's nice.
So it's not just decreasing inflammation and pain, it's healing the tissue.
We definitely need to do a live more about these, because they're there's no adverse events as far as I know, which is quite handy.
Yes.
And you can use them alongside pharmaceuticals and all the other interventions, and owners can safely use them at home. So that's cool. Okay, so we're in your cupboard, and we've put our loop. We're now looking up to the shelf with the lasers, and you've got your whole selection pack up here. What kind of thing would you be going for hip?
I would say you need something with penetration, right? Because you get into hip, and your positioning is extremely important. So if you're just waving something over the hip, you're getting some of the tissue, but you're not getting to the joint capsule. You need to be specific enough that you can go in around the greater trochanter and treat into to get the joint capsule, and then lift the leg, get the pectineus, because it's so important, because he's one of the major hip stabilizers. And if he's in spasm, the dog's not going to be able to extend or abduct, and then he's going to atrophy because he's not moving. So you get the pectineus and the medial joint capsule, and you'll have much, much better effect.
And that's something that I hope every nurse that's listening thinks, right, okay, I'm not just going to focus on the outer, over the gluteals, etc. You've got to follow the whole limb round.
The pectineus is the medial, and then the biceps femoris and the gluteal muscles are your lateral hip stabilizers. So you definitely need to get them. And trigger points in the sartorius and tensor fasciolata. Really common in dogs.
See, this is what's cool, and this is why I think when people are starting to use these modalities, expanding your knowledge and being confident to like palpate, feel, and kind of go, oh, I've got my little Marauders map out. I know what's going on here. I'm going to do a bit here, bit here, bit here, bit here, and you're going to have such better results with it, rather than just treating it's the hip. I'm going to just treat the arthritis. That's just there. Okay, so that's cool. Right, let's go down to the stifles. Okay, so this dog, it's a Rottweiler. It's not a big dog. And bilateral cruciate disease. Neither of them had surgical management. They are pretty ropey. You know, the medial buttress is the same size as the knee, basically. And there's very little movement in them, peg legs. So what kind of thing would you be, reaching for that?
So you're going to use your laser, and then you're going to be doing your passive range of motion, right? So laser to help break up that scar tissue and make it from going like this to be like this. So then it can have some flex, some ability to stretch, so you can get more motion, and then strengthening to stabilize everything. And then preventatively, because that dog, if his knees are that bad, he's pulled all of his weight forward, and he's going to be breaking down at his wrists, and then potentially having tertiary shoulder issues.
Yes.
And back pain, right? Because his knees hurt, so his pelvis is, I have to see where you're here, and his withers are way down here, so it puts a lot of stress on his back, and his lower back is going to be painful.
And you see them, they have these really dipping spines. You're like, oh God, that must be hard. They've got absolutely no core strength. Okay, so same, but we're now dealing with, no, we're going to go different. Patellar luxation. So we've now got little terrier, a Yorkshire Terrier, bilateral patellar luxation. We've got OA changes. What kind of laser would you be thinking for that, and what tips can you throw people?
So what kind of laser? Even though
I'm just giving you a smaller dog. Not so deep.
So you have less penetration, but again, it's all technique. So something as simple as tractioning the leg, right, as you're doing it, so that you can get into the joint capsule, you can get into the cartilage, because we know that we can have an effect on the cartilage. Coming in from behind, right? So if this is where the popliteal fossa is, right behind the knee, I can get to the cruciate in there, because if you have a patellar luxation, you're at a high risk for tearing your cruciate.
Yeah.
I can also get from if I'm coming right in through the patella tendon, I'm going to get the cruciate.
Right.
Right. And I'm going to come above so I can get the joint capsule. The joint capsule actually starts above the patella. And for me, I will literally take that patella and slide it to one side. So put the leg in extension, take the patella, slide it to the side, laser around the going into the groove.
Yeah.
And then go to the other side, and as that patella is slid up, now I can get the caudal surface of the patella. Ooh. And then I switch it around and get into the groove and into the patella. You guys can't see, there we go. So that I can get as much of the caudal patella surface and the trochlear groove surface, as well as the joint capsule, and then get the cruciates, get the cartilage, all of that stuff.
And I think what is great about this is talking to a pro is that we need to step away from just treating the broad spectrum area, you know, just woo in the area. And we need to expand our understanding of the anatomy and the things that you can combine with it. As you said, traction, passive range of motion, strengthening exercises. You know, it's a bit like having half a surgery, isn't it? When you use one of these modalities and you don't see how they can fit together. What about the frequency, not in the frequency, but the frequency of intervals of treatment? So let's go back to the Labrador with the hips, and they were painful. How often would an owner be committing to that session where the whole hip's being treated with class 4? What's roughly per week, per month?
It depends upon the dog and acute pain versus chronic pain, right? So if it's acute, oh my gosh, my dog can barely move, we're going to do it more often. Sorry, you have a motorcycle? I have a rooster.
I love
don't know
it.
if you can hear him crowing. Okay. You know, if he can do it 3 times a week for a week or 2, that can really diminish it so that we can then start to spread it out. And I don't live by like a 3-2-1. I live by what's going on with this dog today, right? So if he comes in and he's super painful, and I know that he's going to be going to the dog park and running, bring him back after he's going to go play with his buddies, right? Don't stop his quality of life if that's what he lives for, but just schedule it so that he does that and then comes to see me.
Yeah.
Right. And then again, I usually treat with the laser and then send him home with a loop or some kind of PEMF device.
Amazing. So I think the take home from that, guys, is that we do have protocols. So I think if you were ever to phone up and ask about laser at your local practice, they are likely to say, look, it's once a week for 6 weeks or twice a week for the first 3 weeks, and then we're going to see what effect it's had. However, you know, that's a very, it's a bit like the fruit and veg 5 a day. It's a very broad guidance. Whereas actually what would be brilliant is for them to say, this is a guidance, but we're going to see how your dog responds. So,
and it depends upon their variability and the person's availability. So if they're like, I work Monday through Friday, I can only come in on Saturdays. Okay, we can help your dog. It's just going to take longer to have the same effect.
Perfect. So that's good to know, because I know a lot of owners will be, as I say, a bit intimidated by 2 or 3 times a week. And they'll be like, whoa, this is not only looking time consuming, this is also looking expensive, etc. So there's a lot of variability is what you're saying. But what we have to do, the same with any modality or pharmaceutical, you look at how your dog is responding. So let's do another couple of joints, and then we're going to talk about how do owners work out whether it is working or not. But let's do another couple of joints. Let's do back. Okay. So a lot of people have dogs with spondylosis or lumbosacral disease, etc. And that can be pretty deep. So we're going to go big dog. So we're going to go for a Irish Wolfhound. I don't know why.
Can't go bigger than that.
Yeah, go big. And so this dog's got quite a stiff lower back. We've got the little bit of the saddle bagging going on, the dorsal pelvic tilting. So we've got the tails a bit down. They're a little bit curved. And you can see that they don't have any fluid movement there. They're already on a non-steroidal. They're also on amantadine. And they heat sack. That's what the owner does. They do some heat sacking. What kind of thing would you be thinking then for that kind of condition?
So first thing is, if it's lumbosacral, not only do you want to treat from the dorsal aspect, but you want to flip the dog over, push the intestines out of the way, and the colon, if you can, kind of scooch around it and get it from the ventral aspect. right? If it's the other thing is I want to treat more energy when I'm going into the joints, and I can treat aiming toward the facet joints, but I still want to use a little bit of energy because I don't need a lot, but to treat all the muscle to get rid of the spasms and the trigger points in there. So it's going to be different amounts of energy in different places.
That's what I've always struggled with, is that, you know, none of these animals that we see are going to have a single pathology going on. So for all the followers, when you've got a dog with arthritis, they're not just going to have inflammation in the joint. They're going to have changes to their joint capsule. They're going to have changes to the ligaments, the tendons, the muscles are going to change. Their posture is going to change. They might have it in their hip, but their neck hurts. And I sometimes struggle, especially when I was learning a lot more about laser. You've got the different wavelengths and different frequencies and the different times, but you're treating different tissues as well. So it becomes very confusing.
Can I give you let me flip this over now. So if you guys can't read this, it says the information about the course, and then coming soon, optimum exercise therapy and pet parent laser therapy. But as a thanks for being here today, if you text OPV6 to 866-949-0068, and you have to give me your first name and your email address so I can send it to you. I have a 2-page laser do's and don'ts that put a lot of information, in case we didn't cover it, a lot of information that will help you with lasering.
So what we'll do is I'll get Laurie to email me that, and I'll put it in the thread as well, so people can do that. That's such a good idea. That is such a good idea. Yeah, because I think it is quite hard when you know that there's mixed pathology going on, and you're thinking, what am I trying to achieve? And you've got this one handheld probe and this one setting for that one region, and you're like going, But that, I guess, is the different wavelengths that they've got in there are doing different things at that point, aren't they?
Well, and some lasers have different wavelengths with different probes. So you can treat one area with one probe and then treat another area with another probe, or treat, if you have different probes, one area and then treat the same area with the other wavelength. And you'll get, all the research that shows that if you're using multiple wavelengths, you're going to have a cumulative effect, as long as your dose isn't too high that you don't. Another thing I have to throw in is understand that there's different things that absorb the laser photons. So if you have a dog that's dehydrated, that has no fat, that's really skinny or fragile and old, you can cut your laser energy by half, because otherwise you're overdoing it, because they don't have the tissue, they don't have the blood flow, they don't have the fat to absorb any of the energy. It's going to go right through, and you can overdo it, and you'll see them be stiff or sore or painful afterwards.
Right. So that's, again, look at your laser settings, and you get taken on a guided journey. Whenever you turn a laser machine on, the class 4s this is, they take you through a step-by-step process of what's the weight of the dog, what's the color, skin color, coat color, how thick is the coat, what is their body condition score. And it's really worth filling it in. Don't just jump to what you did before. Think, what is the dog in front of you? Class 3B, you don't have that. You tend to check a setting, and so you have to use your noddle more. Okay, so now let's move. We'll do 2 more joints, and then we're going to talk about.
Can we talk about elbows? Because that's so important.
Yes.
So I see people lasering with the dog on their elbows, which means you have totally closed the joint. So now if you're trying to treat cartilage, you are literally saying, I'm going to go through the bone to try to treat that cartilage. Instead of saying, okay, if we can put it at a 90-degree angle and traction it, and then feel the edges that, you can't see me, there we go, circle of the joint capsule. So we circle around, well, hold on, here we go. Circle around this way, right? Circle around this way, come from the back, open it up and come from the front. That's how we're going to get most of our joint capsule. If we're just lasering from the side, right? If I'm just lasering from the side, I'm not getting a whole lot in there.
No. And that's something that we need to talk about, is that attenuation. So laser is wonderful, but it's also liable to bounce, isn't it? It will get absorbed and not used, or it will reflect away. So using the right laser wavelength, frequency, time, and also trying to give it the best opportunity to get where it's got to go is really, really important. So
probe position is huge.
Yeah. So guys, be really confident with handling and moving and manipulating.
If you have a laser that is not in full contact, if you are past 30 degrees, right, you will actually get more reflectance off the tissue than you will penetration into the tissue.
Wow.
That's physics, yeah.
Yeah. So we really need to be another variable, position.
Mm-hmm. Yeah.
Wow, this is turning into a complex sport. Okay, so we've talked about elbow. Let's now do digits, and then we're going to talk. And we've got somebody saying, can we go back and recap it all in a much more owner-focused language, which we will do. So, digits. Do you use laser for your digits?
Absolutely. I laser my own hands because I have arthritis in them.
So what would you be using in that sense?
Very low dose. Treating the tendons and ligaments on with the dogs. Most of the time when dogs have arthritis in their hands, it's on the dorsal aspect. But, well, this way. You're on the dorsal aspect, so we're always going to treat the top of the paw. But then if they have trouble extending, then we're going to come from the underside. And if I have any swelling, a lot of times they'll have sesamoid issues. So either on the medial or the lateral aspect, we're going to, any type you have thick bony swelling, or fibrous tissue on top of that, we're going to laser that. And then again, do some manual therapy to get that joint moving so the dog can use their feet better. And that will strengthen the muscles so that they can move better.
Yeah, perfect. Again, wonderful advice about a mixed modality approach. And modalities even include manipulation, moving, traction, heat, getting them to play in sand pits, stuff like this.
Swimming.
Yeah, and I think a lot of people see, I know why I would, in that it's quite an expense in time and money to add these things to a protocol where you've already got them on an anti-inflammatory, you've got them on a joint supplement, they might be on a specialized diet, and then you're thinking about adding one of these modalities. And then, sorry, that's the talk. And then somebody says, well, it'd be lovely if you did mixed modality, because then you can get the best of different things. And you suddenly go, ka-ching, oh my God, this is going to get pricey. But when we talk about modalities, we also mean like manual therapy. We mean exercise, strengthening exercises, changing your exercise routine, balance exercises and stuff. So don't be scared of it. Okay, so now let's just talk about safety.
Hold on, I'm going to back up for 1 second. Understand, we talked about in the beginning when they're in a lot of pain, treating them like 2 or 3 times a week. My patients, we usually get them, even if they have severe arthritis, I'm seeing them once we get them through that pain and we get them going and they're moving and they're exercising, I'll see them once every 4 to 6 to 12 weeks.
Wow. Okay, so that becomes a lot more feasible for a lot of people, doesn't it?
Yes.
And I suppose when you see them at 6 to 12 weeks, you're not thinking they're just coming in for laser. You're reassessing them. And it might be that they come in and you go, I'm actually not going to do laser. We're going to do something different today.
Yep.
So, sorry, this is Luna. No, Luna. Okay, so now let's talk about safety and efficacy and stuff like that. So what about safety? Because we always fear, it's the laser.
If you have a class 4, at least in the US, OSHA requires that everybody in the immediate vicinity have laser goggles on. And it's not just, sunglasses. They'll have writing across the top that say what wavelengths they're okay for.
Yeah.
So different lasers may have different glasses.
Yeah.
With class 3B, it's highly recommended, but not enforced. But to me, safety is so, so important. The other thing to know is the more powerful the laser, the further away people have to wear and the glasses. And OSHA will give a distance for each laser. So some of the lasers may be 3 feet or 2 feet, and some might be 7 feet. And some of the really powerful ones are 16 feet.
Right.
But OSHA will give that laser company the guidelines. So it should be in the company's book how far away you have to be before you can not wear goggles.
So when people see pictures of dogs wearing goggles and owners with glasses, it's not a fashion statement. It really is to protect
safety.
eyesight.
Well, and it's not like anybody in the room is going to be exposed. It's if the dog knocks the laser out of your hand, or they move funny and the laser beam goes somewhere and it happens to hit your eye, that's the only time it's a problem.
Right.
But if it does permanent damage, you don't ever want to be put in the position that you have that problem.
Yeah, no, I totally agree. But what about contact injuries? So some of the lasers, we're talking a lot of wattage. We're talking a lot of joules per centimeter square going in. What about burns? Yep. Is it possible?
Absolutely, it's possible. But that's not the laser's fault. That is the handler's fault. I would say a laser, especially the high power class 4 lasers, are like a scalpel. In the right hands, they can do wonderful things. And in the wrong hands, they can do damage.
Right.
So yes, you can have burns, but you can take a scalpel and really mess something up if you're playing with, put it in the hands of a 2-year-old.
Yep. So just make sure that these pieces of equipment are used wisely.
Okay. Training is super, super important. Again, training.
I love it. Okay, so let's recap and literally in a couple of minutes. Let's try and go back and take it back to a more kind of like first-time dog owner understanding their dog's got osteoarthritis, and their vet has said, right, I've just started you on a course of anti-inflammatories. You've got to go on a bit of a weight loss plan. I'd like you to change the exercise. Put some rugs down because Hannah told you to. We've got a laser in practice, and I think it would really help your dog. Explain to an owner in owner language, what is that laser going to do for that dog?
Depending upon the dose, it can do 2 very different things. At lower doses, the light photons go into the cells. And if you remember from cell biology, you have your cell, you have your nucleus, and inside the nucleus are the mitochondria, and that's what makes the energy. At low doses, the laser photons increase ATP production. So whatever the cell needs to do, whether it be healing or producing enzymes, it can do it more because it now has more energy.
It's like giving a cell a can of Red Bull.
Yes. Okay. Except with all the negative side effects. Yes. Okay. It's positive, all positive. At high doses, we can actually stop that ATP production. So at high doses, we stop cell respiration at the mitochondria. And you can say, well, why would I ever do that? Because you can stop those nerve cells. So for those dogs that are on an NSAID and a pain med and they still hurt, we can stop. It's like what we call an axonal nerve block. We're doing a nerve block with the tissue to stop those pain impulses going to the brain so that we can allow healing. Now, when we use high doses, we actually slow down healing. So fibroblasts, one of the cells that help us create healing, we're shutting them off. So we don't want to use super high doses all the time, or we can go up and down, but we have that ability to stop the pain, stop that cycle, and then work with the other things and lower the energy so that we can have all the positive benefits once we've controlled the pain.
Amazing. So in if a vet was just trying to say at the end of the consult, we have laser at the practice that we can offer to you, and what it aims to do is reduce pain but also aid tissue healing. Yes. And that's something that we would really like to achieve. Okay, let's take some questions for a few minutes, and then I'm going to let you go because I said I'll only keep you for 40 minutes. Let's go back to the beginning. And only cancer is contraindication PMO. Is that true?
Actually, there's the first study that in the US got PEMF device cleared for humans was in breast cancer women that had a mastectomy. And there was no increase in cancer rate. There was literally almost 50% reduction in opioids used. So way, way, way less pain, less drainage because they were measuring that. And then in the exudate, the fluid, there was less inflammatory mediators. Right. So they had better healing, decreased pain. Now, I'm not saying that you should use it in all cancer patients. My personal experience is I won't use it in hemangiosarcoma and osteosarcoma. And because I had a dog who had osteosarcoma who I tried to use a loop on and he walked away from it multiple times. My rule is if you put it on the dog and they don't like it, you don't use it.
Yeah.
Because a lot of times they know what's right for their body.
Yeah, I do. Sometimes you just don't mess with what they're telling you.
Right. And I would never put a bed in a cage or somewhere where the dog can't get off of it.
Mm.
Have it laying out so that they can walk around. They decide they want to get on it. You can plug it in. And this way they can choose.
I agree. Someone's just saying that just for our own knowledge, have you heard of MLS laser?
Yes.
Oh,
yep. That's from ASA. It will not cause overheating. The company just put out or is putting out an MVAT. So that is a heating laser from what I understand. It's like brand new, but it's a higher power laser. But the MLS is non-heating. So I've used it. I've used almost every laser out there. I've used it on myself because that's how I test them, right? Because I can tell if it stops the pain. So it's a good unit. They're all good units.
What about muscle wastage? Can laser help?
Yes. So there's studies looking at 904, 905 wavelength with professional athletes and competitive athletes, treating them in the quads, hamstrings, and calf muscles before they exercise. And there was significant increase in muscle strength within a few weeks. And increase endurance. And what was really cool is that if you want to increase strength, you do it beforehand. And if you want to do it, if your goal is to increase endurance, you have better results if you do it before and after compared to just after, or, I mean, they did all the variables. So it was a really cool study.
Amazing. Check that out. So the lovely Angel's asking about recommendations for PMF and laser. What we can't really do on this platform is just going to go this company, that company, because we try and stay really unbiased. But you're more than welcome to contact Laurie privately, and she'll give her advice to you, because she does work with lots of companies, and she'll be able to help you choose the one that's suitable for your needs, hopefully. Where is this? What is a CC? We'll cover that later.
One thing I do have to say, if you're using PEMF and laser, you don't want to do them at the same time. That's really important. It's not going to hurt anything, except if you're lasering and you happen to be on, at least in a CC bed, I'm not sure about a Respond or Beamer, the laser itself can damage the electronics in the bed, right? Plus, if both devices, both technology, both have multiple modes of action, but both work on the nitric oxide synthetase cascade.
Yeah.
So, and it takes 2 hours to have that. So if you want the most effect, you want to wait. So you have all the effects of the laser, wait 2 hours, and then use a PEMF device. So you have all the effects of that. Again, it won't hurt anything, but if you want the most efficient and efficacious treatment, you would wait 2 hours between.
I didn't know that. That's good. I'd also, let's answer this one, because this is about your course. So when do you think the pet parent course will become available?
It is being written now. So I'm thinking maybe like January. Perfect. That's what I'm hoping for.
So we will keep you posted, and you can come and tell us all about it when it comes out. We can make a much more owner focused talk, so that people can feel a lot more comfortable. We don't ever want people to feel that it's above their head. That's not what we're trying to do. But CAM has got therapists, vets, nurses, and owners that follow it, and we try and cater for everybody's needs. I wanted to ask about medication and laser. Are there rules? Because I think I read something about steroids. If a dog's
you don't want to laser over a steroid injection for 2 to 3 weeks.
Okay. And what about if a dog's on a systemic steroid dose, like they've got skin allergies?
That's not a problem. The other thing I would think about, though, is you don't want to inject anything and then laser over, especially with a heating laser.
Right.
Because we don't know if heating up that substance, even if it's a vaccine, is going to change it, make it better, make it worse, make it painful. We just don't know. So it's just not worth doing.
Good point. But I was taught that laser energy was mainly absorbed by the mitochondria in the muscles. How does this knowledge relate to treating the actual joint affected by OA?
It is affected by the mitochondria in the muscles and the mitochondria in every other cell. One of the major... So cytochrome C oxidase is one of the major chromophores, right? So that's what they're talking about. Heme. So all of your blood have heme on it, and that's one of your major chromophores. Melanin. So you have melanin in your skin. So you're going to have absorption there. And then water, right? And there's water in all tissue. So there's going to be absorption there.
Yeah. Yeah. It's complex, guys. It's not just a case of whipping it out of the bag and whizzing it over the area. To get the most out of it, it's really about using your noddle of what you're trying to achieve. And I'm definitely more of a convert to the multimodal, bringing different disciplines into use alongside it. We'll take one more question and I'm going to let you go because we're hitting it at 60 minutes. Right, what's this one? For dogs with hind limb or global paralysis, peripheral neuropathies, FCEs, where would you advise the best place to laser? Whoa, good question. Joints or spinal cord?
Yes. Right. So definitely spinal cord. And there's things that we can do like flexing the spinal cord and then aiming directly into the intervertebral foramen. So the holes where the nerves come out. So you can get the nerves where they're coming out and into the spinal cord. But you also, if the dog's laying around, you can laser the muscles in the back legs to help blood flow, as well as doing exercises, even bouncing or tickling the toes to get them to withdraw,
Nice.
so that they can have some motion in the back legs. Otherwise, what happens is you get the nerves to come back, but you don't have the muscle for it to affect. So you need to be working with the muscle at that end and the like an FCE. If you can isolate, a lot of times it's just, T3 to L3. So you're treating that whole area. But if you can say, oh, it's, between L3 and L6, then we can treat in that area and then go from there.
I like it. And again, every time that you give advice, you make it really clear it's not a standalone. You're adding this, you're adding that. And a lot of the additions are very cost effective. They're free of charge interventions, traction, passive range of motion, strengthening exercises. These don't cost money, guys. But I think having the attitude of taking your dog into the vets twice a week to have laser and then miraculously trotting out and nothing else needing to be done, that's a bit unimodal, isn't it? It's you're not going to get the best there. Amazing. Let's put you away. Thank you so much. You have been incredible. I'm definitely getting you
Thank
back
you.
because you're incredible.
Awesome.
Just tell them about your course once more.
All right. So I'm going to put this back down. So you can text OPV6 to the phone number, and you're going to put that out there. The course is for veterinarians, technicians, and physical therapists, and it's 19 hours in small bits. So it's 5-minute to 30-minute, no longer than that, videos that you can watch, and then there's a small quiz, just a couple questions after, and then you can get a certification that, hey, you are certified by OPV in laser therapy. It goes through everything you need to know about laser, as well as how to treat, where to treat, why to treat, all really cool research. There's a ton of research. There's references. The slides for the didactic stuff. So when I'm talking with slides behind me, you get a copy of all of those. For where I'm teaching you how to do it, it's translated. So if you're a visual learner, you can read through it and go, oh, I want to see this again. And it's got the time on there so that you can go back and watch the video.
It's a hell of a package. It is a hell of a package. And I think it's a really good investment for somebody that is taking laser into their practice so that they can be the best that they can be for their clients. So I think it's a really good course. So there you go.
And I've had several people where they've, the head vet bought it for everyone who touches the laser and have said things like, used to be someone was coming in for laser and everyone would hide. And now they're confident and happy and they know what they're doing is helping. They get better results. And it's just made working with everybody even better.
Yeah. And you get to discuss what you're doing and why you're doing it, rather than just plugging it in and waving the wand.
Right, so, which is kind of boring.
It is kind of boring. I totally agree. And especially if you're doing a dog that's shoulders, elbows, back, hips, knees, you could be there for half an hour. Cool.
Yay.
You're amazing. Thank you so much.
Thank you.
And guys, anybody that has felt that this was a bit over the head, I really, really apologize. That's not what we want to do. There are many, many Facebook Lives in our YouTube and on this Facebook page that cover everything to do with OA. I think we've been doing this about 4 years, nearly once a week. It's crazy the amount of information there. So please go and dig out another live and you will be blown away with the content. Until I think there's one on Thursday. I can't remember what I'm doing Thursday, but I will see you guys later this week. Thank you so much, Laurie.
You're welcome. Bye, everybody. Hope you had fun. Hope you learned something.